Jakarta and its greater areas are being impacted by the unhealthy and worsening air pollution, bringing respiratory problems to their inhabitants. To know more about the impacts of air pollution to human body, we are now connected via Zoom with Dr. Efriadi Ismail from Persahabatan Hospital, Jakarta. Hello, doctor.
Hello.
Thank you for joining us today. How serious is
Yes,
the impacts of the current air pollution in Jakarta and its surrounding regions?
yes. This is the condition. Air pollution today not only attack in respiratory system, but also can attack in our system in cardiovascular and also in our brain system. Because in acute condition, when we contaminate by air pollution, we can suffer some symptom like coughing and sneezing, and also maybe chest tightness of breath, and also can make some patient with asthma and COPD can be in a attack condition. So they need to be go to emergency ward to get some medication or oxygenation.
Okay, you already mentioned some of the symptoms that are caused by air pollution, but can you specify more the short-term and long-term impacts of air pollution to human body?
Yes, for the short-term effect in our body, like a respiratory system, we can have some condition like ISPA or upper respiratory tract infection, and also asthma attack, and also COPD exacerbation can make some patient to go to emergency ward and go to some medication like oxygenation, and also in patient with a condition like a cardiovascular system disease like hypertension can make some condition to be get some heart attack, and also can make stroke condition in some patient. In chronic condition in our lung, this pollution can make some growing of cancer. So in the future we can get some patient with condition have lung cancer because of air pollution in long term.
So, is it true that some people said the air pollution can also cause stunting in the future?
Yes, for the stunting in the future for women in a pregnant condition that get some air pollution in long term can make some growing in fetus in a baby condition can suffer less oxygenation, and also can make the baby born with a low weight the birth in the low condition, and also can make some neonatal condition can make some infection like pneumonia and also bronchopneumonia, then can make the baby need some medication in the hospital.
Okay, so on what level or symptoms should we seek for medical treatment?
Yes, if we have some level condition like we're feeling the chest tightness and also feeling breathlessness, and the frequency of rate of our respiratory inspiration more than 24, and also in the condition need some oxygenation. So we have to make this patient go to emergency room to get some medication. But in light condition like only coughing and only fever or irritation in the throat, that can make only go to polyclinic to get some medication from outpatient medication.
All right, so what are the preventive actions that we can do?
So the preventive condition, if we make outdoor activity, we should make use masker. The mask, the recommendation must we use N95 like in COVID condition. But if we not have N95, we can use mask like KN95, or also surgical mask is still useful for protection to us to reduce air pollution effect in our body.
All right, So do you see patients build up at your hospitals at the moment because of the air pollution?
Yes, in Persahabatan Hospital, we know Persahabatan is the top referral of respiratory disease in Indonesia. So many condition in patient with asthma, COPD come to our emergency ward with the condition with worsening symptom like chest tightness, and also they need some medication like oxygen, and also need the condition patient need some medication like antibiotic because infection because air pollution impact.
All right, so it is very dangerous for certain people. So what can we do, or what can an individual do then to remain healthy at this condition?
Yes, for this condition, I suggest to our people in the Jakarta, especially, and also in our big cities in Indonesia, if you go outside, please use masker. And also, if you take some medication if you have symptom, and also you should eat the nutritious food, and also make some exercise, maybe indoor exercise, and also this time to sleep with sufficient sleep, and also you have to feeling freshly and not depressed of any condition, so we can make our body still healthy, and also our mental is still healthy also.
All right, can you give us like maybe tips on getting our body to be fit? Like, do
Yes,
we have to take
there's
like
some
some
tips.
certain vitamins or anything, or any food that you can recommend?
Okay. There is no specific food for this condition. I suggest still you consume some food like with high nutritious food, and also you should drinking, so drinking much, and also sleep with sufficient time sleep, maybe more than 6 hours in a day, and
Oh,
also you should take some exercise regularly. Maybe I suggest take some exercise in indoor exercise.
all right. My final question, if you could give suggestions to the government to reduce air pollution in Jakarta and the surrounding area, what would it be?
Yes, our organization, Indonesian Society of Respirology, has suggested to our government to make some to reduce condition. Maybe we suggest giving some masker to our people in the outside, and also maybe a limitation of transportation, and also we suggest the government to make some rapid mass transportation, that can people change to private transportation to public transportation, and also uh, reduce using coal fuel as a fuel for industrialization.
All right. Thank you, doctor, for sharing that important information on TV Our World.